Where is the integrity of caring about the outcomes for our children, long-term health effects? And sadly, I've seen surveys that show that on the scale of what's important in a community, I know we have to solve the budget crisis, but our children are coming way down here, 8, 9, 10. That's unacceptable.
My views in no way represent the DC Fire Department, but I can say that what I see impacts me as an individual. And going into homes, seeing the apartment complexes filled with marijuana smoke on a regular basis every time I go into these apartments, and seeing young kids in these apartments, 1, 2 years old, just sitting in marijuana smoke.
Children don't have a say in their health. They rely on their parents, and they rely on their parents to be of good, sound judgment, of sound mind and good judgment. And if your parents are getting high, you're not even likely to go to school every day.
What it should be all about is the health and safety of our kids, because they're our future. We're 43 in the nation in high school graduations, and we're #1 in pot use. We're #1 in vaping. We're #3 in abuse of all illicit drugs, and we're #9 in suicide. That good for your kids? We're losing them daily.
When something's this easily accessible, then we're not going to think twice about it.
When something is legal, the implication is it's okay.
My kids also tell me about how hard it was to not do marijuana living in California.
In my math class last year, some kid hit a dab, like in class, when my teacher was turned around.
We're giving too much credit to people just because they're adults, that they would also be responsible.
I smoke weed pretty much every day, multiple times a day, like breakfast, lunch, and dinner. My mom and I smoke plenty of weed together.
And I see kids who are 10, 11 who are using, and no one enforces that unless the parents are enforcing it, and the parents are sometimes their supply.
You know, I feel like it's robbing my kids of a certain level of innocence that they deserve. They deserve to go through middle school and have their biggest concern be, you know, seeing the boy they like in the hallway, not, you know, coming up against drugs and pressure to take drugs. You know, especially the kid that passed away in our middle school, that was just heartbreaking. And I think, you know, the parents that think that this is okay, I would just challenge them to really look at the data. Don't just look at, you know, oh, I did a little marijuana when I was young. Really look a little deeper, really look at what's happening with these kids, because it really opens the door to so many other bad things.
I think a lot of parents have trouble talking to their children because they in fact are marijuana users or have used it, so they don't want to come down hard. A lot of parents say, I can't really go there, it's just marijuana, they'll figure it out. But the problem is they don't understand the high potency THC.
I'm not going to be a hypocrite and say I haven't tried it. I actually have, and the challenge is it's not the same.
I think people get a perception of, well, you know, our kids wouldn't do that. You want to bet? It's every social economic group that you can imagine, you know, unless there's a household where the parents are accepting and joining in, and there's plenty of that too.